Okay, so we're talking about another treatment modality. So this can actually serve as what? Like 2 in 1. All right, so you can use it for treating, you can also use it for what? Diagnosis. So this is the endoscopic hemostasis. You use this for variceal bleeding. All right, so you're basically trying to like clip up all the bleeding regions, you know, in somebody that has variceal bleeding. All right, so endoscopic hemostasis, so that's a cornerstone for managing variceal bleeding. Now this is particularly in patients that have portal hypertension due to liver cirrhosis. So looking at how it works, we said that for the role of endoscopy in variceal bleeding, so that endoscopy serves both diagnostic and therapeutic purposes, just like I was telling you. So it's through endoscopy we can get to what? Take all these pictures to help us confirm that okay, there's variceal bleeding. Then also through endoscopy we can clip up all these regions that are, you know, serving as places where blood is actually leaking out, you know. So for diagnosis, actually identifies the bleeding source, typically esophageal and gastric varices. For therapy, allows for immediate intervention just to stop the bleeding. Right. So endoscopic hemostasis techniques include the endoscopic variceal ligation, is a gold standard for what? Esophageal varices. Involves placing what? Rubber bands around bleeding varices to cut off. All right. Not here, but the rubber band is quite popular stuff. Okay, involves placing rubber bands around the variceal bleeding. You cut off the bleeding. Preferred over sclerotherapy due to few complications and better outcomes. Endoscopic injection sclerotherapy involves injecting a sclerosant into or around the varix. Right, tissue adhesives. Alright, especially used for gastric varices, which are less responsive to banding. Alright, the glue polymerizes on the contacts, okay, with blood, sealing the varix. Hemostatic powders and clips. Alright, so for timing and adjunctive measures, urgent endoscopy, so within 12 hours is recommended for variceal bleeding. Vasoactive agents could be used, you know, you start them before the endoscopy, you know, just to control the bleeding before you actually come in with the surgical approach. Antibiotic prophylaxis, because you want to actually prevent any infections that could come up. Right, so that's it for this.